Hi, it's me again. I'm really just wanting to talk to you about endometriosis and all the effects and how you deal with it day to day and stuff like that. When I was first diagnosed, the only real way to get diagnosed with it is through getting a laparoscopy. Now, for you, any of you that don't know what a laparoscopy is, it's basically a camera through your belly button and one on your pubic hairline. They blow up your stomach with a gas, so they can get a better chance to look around. Now, a lot of surgeons, I think the majority of them do it in America, where when they go in, if they find any endometrial tissue, they remove it. But you only really get that if it's a surgical laparoscopy, whereas normally it's got your first laparoscopy is what they call a diagnostic laparoscopy, where they're purely just going in, having a look around, seeing if you've got endometriosis. If you have, they come out again. In my case, that's what happened. They went in, they had a look around, they seen that I had endometriosis, they didn't do anything, didn't touch anything, came back out again. Then I was put on the injection that puts you through the medical menopause. My symptoms of endometriosis, everybody experiences different symptoms. Mine, mainly for the first, I think I started getting symptoms when I was quite young, but you didn't really know what it was, because girls are sort of told that when they get their periods they're meant to be in pain and it's meant to be sore, and mine did just start off with period pain, and then I was fine when I wasn't on a period. I was on the pill for years. I went on to the birth control pill when I was 16, and I was on it until I was 30. In between that time of 16 and 30, my pain was gradually getting worse and worse and worse, to the point where it wasn't just when I was on a period. Sexual intercourse could be really, really sore, to the point where after it I was curled up in a little ball. It's not really something that you want to talk to other people about. You just kind of assume that it's normal and you get on with it, but it's not normal. No girl should be that sore after sexual intercourse. Sorry. Then I was going to the hospital. I went to my doctor's first, and then my doctor referred me to the gynecologist. They told me that I was fine. She sat down, she drew me a little picture of my insides and what they look like, and said to me, no, this is all normal, don't worry about it, you're fine. So I went away. A couple of years later, the symptoms were getting worse. Went back to the hospital again. They gave me a scan. Now, they told me that the scan showed up twice. The scan showed up fine. Now, this happened twice. I had 2 scans over, I think it was about 4 years. And they told me that I was fine. Now, endometriosis does not show up on a scan. The only way really to diagnose it is through a laparoscopy. If you have what they call chocolate cysts or other cysts on your ovaries, then they can show up through a scan. But endometrial tissue you can't see unless you get a laparoscopy. Before, when I came off my pill when I was 30 years old, because the birth control pill can mask your pain, so when I came off it, it took about a year, I think, and I started getting really, really sore. The pain, and everybody experiences the pain differently, but my pain was to the point where I couldn't do anything. I couldn't walk. I couldn't have sexual intercourse with my partner. Everything was really, really hard to do. I was really tired. Didn't matter how much sleep I got, I was still really, really tired. I went to my doctor's. They gave me, again, tablets for IBS. Took the tablets for a month, no difference. Went back in tears, saying to my doctor, look, please, you need to do something. It was excruciating pain. So the doctor referred me to a gynecologist. I had to wait for about 6 months for that appointment to come through. When I went in and seen my gynecologist, he agreed to do the diagnostic laparoscopy. Think I had to wait about another 6 months for that. Now, once when I went in for my diagnostic laparoscopy, obviously I just wanted to know what was wrong. I hadn't really heard of endometriosis. No doctor ever said to me endometriosis. Now, endometriosis, you can be born with it, and then the cells develop when a woman comes to an age where she starts getting her periods. Endometriosis tissues, once they're in your body, they can grow and spread anywhere they like. They could grow in your lungs. There's cases where they could attach themselves to your spine and go up your spine, on your ovaries, on your womb. There really is, it could attach itself to anywhere. In most cases, it's usually in the reproductive organs that they attach themselves to. But it can, once it's in your body, it's in your body. There is no cure, and there is no way to get rid of it. Even a hysterectomy, which I've had myself, there's still, that's just now, it's only 4 weeks since mine. I'm in pain because of the surgery, but I'm not really feeling any endometriosis pain just yet. But that's really because I'm still sort of on bed rest. When you have your laparoscopy, you will experience some discomfort. For me, it was more the side effects of the gas. The gas that they use to blow up your stomach, it affects the nerve system in your shoulders and your back. So for me, the first 2 weeks, my back and my shoulders were really sore. But you could take, it was manageable. I'd take painkillers and I rested. But you do experience some discomfort. But if any years are going for the laparoscopy anytime soon, don't worry, it's really not a bad surgery. A couple of weeks and you will be fine. And I know everybody experiences it differently. Some women need to take longer, but really 2 to 3 weeks and you should be fine. Then after your laparoscopy, if you're diagnosed with endometriosis, then I really would sit down and speak to your gynecologist about it, get all the information that you can, research all the information that you can yourself. Myself, because I'd never heard of endometriosis, after my laparoscopy, I was basically told by my gynecologist who did my surgery that I had endometriosis. It was all over my ovaries, and they were going to put me on this injection, which basically puts you through the medical menopause. Now, at the time, I was just so relieved that they'd actually had found something. I just agreed to it. I was just, okay, yeah, do it, go. My case, the injection didn't work. It made me feel worse. It gave me so many different symptoms. Some people it works for, some people it doesn't. But mainly, I want you to know that if you do have endometriosis, it's a horrible disease, it's a lonely disease, but there's lots of women who go through it as well. You're not alone. What you're going through is a really, really hard thing to go through. You're going to have days where you feel really down. You're going to have days when you feel so alone. But just always try and remember that there is normal girls like yourself, like me, who are dealing with it every day as well. If you can, join a support group. Talk to other women that have endometriosis, because you're not alone. You will get through it, but you will have really bad days. Myself today, to be totally honest with you, I'm feeling quite down, even slightly a little bit depressed. That's because I didn't sleep last night. My night sweats were horrendous. I think I'm maybe even starting to develop some insomnia because I can't sleep. And that's probably one of the reasons why I come on and did this video, because I want other women to see that even just normal things like feeling a bit down, that's normal, and there's other girls out there feeling like that. So really just try and remember that you're not alone. You're really not. Bye.